sunny, high 68 tonight, mostly clear with a low in the mid-40s. Tomorrow, partly sunny with a high of 77. That's the forecast. From the AHP Weather Center, I'm Barry Banker.
AM Impact on Your Health is sponsored by Dennis J. Courtney, M.D., Director of the Courtney Medical Group, located at 3075 Washington Road in McMurray, Pennsylvania. For more information or to make an appointment, call 724-942-3002. That's 724-942-3002 for Dennis J. Courtney, M.D.
Good morning, everybody. Good morning, everybody, and welcome to AIM Impact on Your Health. AIM Impact on Your Health, where every day our goal is to have you learn at least one thing to help you live better and longer. AIM Impact on Your Health, heard every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney, and I'm with you each and every Monday, Wednesday, and Friday from 8 to 9. AIM Impact on Your Health, where each day you'll find current medical news, knowledgeable guests, fascinating health topics, and where, of course, we always encourage you to call in to join in. Today, we're going to open them up to you today. Those who are inclined to go get a piece of paper and a pencil, we're going to give you some facts, some scientific facts about this controversy out there about beluga and nattokinase, and get some research stuff that I think resolves this problem. I've been talking a lot about it in the last couple of shows, and we've had some time. We'll take a little bit more time, but I think to close off this discussion today by ultimately giving you the statistical information that I think most persuaded me, and would be the final amount of information that you may need to equally persuade you. And so we'll be talking about clot busters just a bit, but look, that'll be my entry into today's show. You can elect to come on in here and talk about anything you'd like. Of course, to do that, you have to dial up a number. You know the number, and if you don't, well, with that pen and paper, why don't you write it down? 412-825-6262. 412-825-6262. You can set the agenda today. Anything on your mind is okay with me. Question or comment, it's not important. It's just you get it off your chest. And so I'll be listening for that knock on the door. Now, with respect to calendar issues and things like that, I spent a nice little conversation yesterday. You know, we had Mr. Rick Hill on the show on Monday, and I'm thinking about being diagnosed with a malignancy 34 years ago. Told the Mayo Clinic that he wasn't going to be around too much longer. And here it is 34 years later. I thought he had an interesting story. Also, brought and introduced to us an interesting concept of these air purification systems. Intrigued me enough that I told him, look, have that company get a hold of me. And I talked to the owner or the CEO of that company yesterday. The name of the company is called Healthy Perceptions. I'm getting some information sent to me. I promise to have more on this subject. I felt that what we learned about these air purification systems, and you can't turn on your television set without finding some commercial at some point, a sharper image it comes to mind, others where there are these air filtration systems, and I emphasize air filtration because they kept using, Mr. Hill, kept using a term that finally resonated and I caught on, which was the bulk of these devices require that they pull the air in the room through the filter in order to work. So for it to be functional, it's going to have to do a lot of pulling, a lot of air. It's going to have to be passed into the device in order to be cleaned and come out the other side. And what I noted was that the device that he was talking about, this device made by Healthy Perceptions, doesn't work on that principle. It's not a room puller. I guess that's going to be the new term. Not a room puller. It emotes something and puts it in the room. And what it puts in the room is what does all the work. Sort of like in the old days what ozone, and it was a powerful and potent air purifier, but it had toxicity components to it. So much so that most of the ozone units of today that have the capability of working usually only have an industrial use, and usually only in industries once everybody's gone and the lights are out. So anyway, more will be on this subject. As soon as I get some information, I promise to bring it back to you. We're going to get Mr. Hill back, excuse me, Mr. Hill back on the show too in the near future. So wanted to mention that I really enjoyed spending the time with him on Monday. Also, I get contacted as a publicist called PR Group, and there are a number of other guests we got lined up. I just don't have the dates. We sent them out, the dates that were open, and they haven't filled them up yet, gotten it back to me. So it looks more like by Friday I'll have the dates that you can start to put down on your calendar for who the guests might very well be. Want to mention, this week, and I think they got their Thursdays right now, okay? They're having a little trouble, but the Freedom of Choice and Cancer Therapy Group, of course, meets, as we all know, and we've known for a long time, meets on the third Thursday of the month, up just about a mile south of Butler, at the Days Inn. This is all information that's just common knowledge to us. 7 o'clock is usually the start time, and so everything matches up. You won't have to get reoriented as you did last month when Tom Levy came to town, but you're going to have a speaker up there this Thursday, April 15th, tax day, 7 o'clock, so that's right on. It's the third Thursday. It is at the Days Inn. It's at Route 8, just south of Butler. The speaker's name is Paul Neeson. He's a raw food chef and author, and he's going to be talking about something called the Daylight Diet. Guess who's coming to dinner? Hope you all enjoyed that up there. Glad I had a chance to help out and promote them. So if you're a constant devotee of the Freedom, Choice, and Cancer Therapy Group, you already knew about this, and if not, hey, maybe I've titillated you a bit to go on up there and check it out yourself. Of course, also, too, for the spirit, those who have an interest in trying this wonderfully tasting 14 biblical fruit purees, 1 ounce serving, has the nutritional value of 5 servings, and combined with the alkalinized minerals from the Dead Sea, herbs like frankincense and myrrh, boy, it's tough to find those in any other product, and then 2 resveratrol. Anyway, for those of you who are interested in trying it, 2 ways to get a hold of the stuff. Well, third way to get started, you can come on in here and see me. We keep a supply on hand so we can give you a taste of this stuff. I think that's really not fair because once you taste it, you go, oh yeah, I could really get to enjoy this. But if you want to try it without coming in, why don't you call them up at 1-800-442-3793, 800-442-3793. The last little commercial item, of course, that I'm a big promoter of, are the transparent holographic chips by a company called Ciara, C-I-E-A-U-R-A. We've now had them quite a few months. I don't know, they're going to, I think, surface in other areas of the town. The launch in Houston is about 3 weeks old now, and so there are now 5 chips, 5 different things that can be treated through the replacement of these holographic chips that you don't swallow them. You put them on the body in various places, depending on what it is that you want to treat. Sort of in keeping with the Chinese acupuncture meridian theories, but not using needles in any way, because it's actually way too important to be precise, and that's why it's such an art to develop in terms of being able to be an acupuncturist. But there's a 4-inch square area. These chips are large enough. The energy they're impregnated with is also of a magnitude large enough that they can encompass. You're going to be it's pretty difficult to miss the placement of these. Anyway, 4 different things you can treat now. Five things you can treat now. Pain problems, difficulty with sleep, the issue of adding energy, getting a boost, getting a kick there, and then the two new ones, which were unveiled at the launch in Houston 3 weeks ago, which would be number one, EMF, electromechanical field disturbances, the chip for that. Lord knows we're bombarded enough with this stuff. And then finally for the athletes, whether it's a weekend athlete or whether it's a more devoted athlete that works out every day. There are always aches and pains and bothers that come along with training, especially with advancing age. Anyway, all these chips are now available. To get them, there is no 800 number. You got to get somebody to get online for you, or you got to get to your computer and get online at the website, which would be www.drcourtney, spelled with a D-R, C-O-U-R-T-N-E-Y, .Ciara, CIEAURA.com. www.drcourtney.ciara.com. Okay. Let's do this. Remember, we've opened it up to you today, 412-825-6262. Anything on your mind is okay with me. I'm going to bring out the statistical information that's been lacking here, and I'll share it with you to, I think, nail this whole issue shut. We introduced Clot Busters a couple of weeks ago. It became a popular topic, and I've been promoting, and I've been telling you, look, between these Nano and Beluque, this Beluque is head over heels the better one, and it was one you didn't know about. Well, now let me give you the statistics that I hope nail this conversation shut so we can put it to bed for a while. Let's come back in a moment after this short break.
Courtney, MD. We become confused about how best to manage your health. It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow that seems to be reasonable enough, but no matter how dutifully you follow the instructions, it just doesn't quite produce the results that you are looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, MD, is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Dr. Courtney,
Mm-hmm.
we have one call waiting at this point, and I will not beep you for that one call.
Thank you very much.
Just one ounce. That's right. Through the Spirit. The blessings of Through the Spirit are now formulated into a delicious whole fruit puree product rich in antioxidants and minerals. Your health is more than just a test result. It's a balance of physical, spiritual, and emotional factors. You work regularly to strengthen your faith, but Through the Spirit help cover your nutritional needs in a convenient and cost-effective ounce a day. Call 1-800-442-3793 for a special promotional offer. Through the Spirit, a blessing for your good health. Through the Spirit, 5 servings of fruits and minerals with no added sugars. That's 1-800-442-3793 for your good health. Call them now, 1-800-442-3793.
Hey, good morning, ladies and gentlemen. Welcome back once again to AM Impact on Your Health. Heard here in KHB 620 each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney with you on this Wednesday version of the show, and we've opened it up to you today. We're allowing you to come on in here and set the agenda. 412-825-6262 will allow you to do that. I'm going to give you some information about, and I think that bringing the discussion of Clot Busters maybe to a conclusion for a while. But in keeping with my promise, you always come first around here. And in the interim, We did have someone dial us up while we're on our break. Let's bring them ahead and say good morning, hello, and welcome aboard.
Yes, good morning, Dr. Courtney.
Hi.
On the subject of catheterization,
Sure.
how long does the procedure usually take?
Oh, geez, they could take as short as 20 minutes, depending on how clean somebody. And of course, we're talking about threading a small little catheter in the groin, usually all the way up to and into the heart, and then into the coronary system. This is where catheterization really is taking place 95% of the time. And on advancing this catheter through, they're able to take certain readings, pressure readings, blood flow readings, and they're looking for diminished flow where they can either do one of two things, either angioplasty, which is if they find a narrowing due to plaque formation, they'll use a balloon and blow it up, and then sometimes placing devices, wire-like looking devices called stents. But if they need to do any of those other things, then it's going to take longer than the 20 minutes. But as short as 20 minutes, as long, and I've been involved in a couple, been as long as a couple of hours.
Well, if a person has severe regurg, is it safe to elevate the torso while they're doing that?
I think they're going to have regurg. You're talking about esophageal regurgitation, where stomach contents.
No, it's heart.
Oh, you're talking about regurgitation
Back to the heart, yeah.
through the valve.
Yeah.
Okay. Well, there's no. The issue is you have that regurgitation phenomenon, whether you're being catheterized or not, and so what becomes important when valves are involved is what is the amount of flow that returns, or how much obstruction is there to the forward flow. When there's a stenotic valve, the numbers are phrased in what do we call them, pressure gradients, because of the narrowing due to the obstruction. They're going to need to know what the pressure gradient is on either side of the valve. So that's on the stenotic side. On the regurgitation side, meaning that the valve doesn't close properly, they'll want to know how much backflow of blood occurs during the relaxation phase of the heart, and make a determination in either way about the competency of that valve and whether that valve meets the criteria to require replacement. Obviously, this is why one has to sometimes get these catheterizations, not for purposes of having somebody get an angioplasty or a stent, which is by far, in percentages, the highest number of cases that could cath, but there are a group of patients, too, that have valve problems, and whether they're stenotic valves and impede the forward progress of blood, or whether they are regurgitation valves, which allow the backflow of blood from an improperly closed valve, they'll have to take certain readings to make a decision as to whether it needs to be replaced. Does that match up to what your understanding of this is?
I think it is. At some point, does the doctor doing the catheterization, does he or she, do they make the determination if the heart is operable? I mean, to be operated on, or is that up to a surgeon to make that final determination?
First of all, they'll take a couple of factors into play. Number one, what is the patient's functional activity capability? In other words, I've seen some pretty bad numbers on patients, but if you talk to them, if you ask them what their activity levels are, they're doing just fine. And in those cases, one would never recommend, I don't think a doctor would ever recommend, that no matter how bad the numbers look, you're doing okay with that set of numbers, and so no, you shouldn't do a thing. But it's when quality of life issues start to match up with these numbers that go awry, whether they're because of a stenotic valve or a valve that's incompetent and causes blood to allows it to flow backwards. Whenever you have the numbers reach a certain threshold, and those are written, that's easy. That's an easy part for the surgeon to make a decision on, because the literature tells them if you have a pressure gradient of X, then surgery should and could be considered. And if you've got a regurgitation factor of Y, surgery could be and should be proceeded with. the vague factor, the factor that doesn't come out in black and white and make it nice and easy and tidy for the doctor, is what's the functional capability of that patient. So that by far is the most important of the two factors that will go into, and plus how healthy or ill the person is and can they withstand that surgery is a big thing. Let me just tell you, though, funny thing, a very good friend of mine, doctor friend of mine, who I'm affiliated with, actually, is 83-year-old. I mean, he's like a bull. He's 83. But he recently went out to the West Coast to have a valve replacement, and I said, oh, my goodness, before he went out there, this is really scary, because an 83-year-old getting the kind of procedure done that I knew was going to be required, this could be devastating. This could be lethal. Well, you know what? His doctors did a fine job with him. I talked to him a week after the surgery. He sounded fantastic. He felt fantastic. So, on the one hand, an 83-year-old, you think, well, that isn't really a good representative of a person that maybe can withstand these surgeries. But age alone cannot be the factor. The guy was as healthy as a bull, I thought, before he went, and age or not, he did just fine.
So the catheterizing doctor would send his recommendations to an actual valve surgeon then for his heart operable.
Yeah, because the doctor doing the catheterization more than likely is not the surgeon. He's a cardiologist, and he's not trained in surgery, but it's the cardiologist that will make the recommendation to the surgeon that the patient, the candidate for surgery, be considered by the surgeon, and then the surgeon will take over from that. So the cardiologist who does the catheterization makes the recommendation, the referral. The surgeon ultimately decides, based on all the factors that only a surgeon can take into account, as to whether the surgery should be recommended to that patient, and he or she would agree with it. And then when things line up, we got a match, and off to surgery you go.
That's my concern, because I already talked to the surgeon, Dr. R, we'll call him. He says make sure you do the catheterization, make sure they put no stents in. The cardiologist says, if I make the determination you need a stent, you're getting a stent in, and I'll tell the surgeon later.
Oh, boy. You know, you want everybody on the same page, okay? Let me just say, when you get this kind of mixed signals from two respected docs that are managing you, when there's a flag that comes up that signals that they're not in harmony, that there is discontent or potentially discontent, you need to stop.
Yeah, I know. Actually, the surgeon recommended this cardiologist, and now the cardiologist says, I will make the determination if your heart is operable or not.
Okay, let's say that he's not the surgeon. He can make a recommendation as to whether a candidate meets the criteria to be considered for surgery, but only the surgeon makes the final decision as to whether there's a surgery that will take place. Now, I think that there needs to be there is discontent in your doctor in your doctor group there. Everybody's got to be on the same page, and if there's a reason why they're not, it's got to be ironed out, and it's got to be brought to a point where you the patient can be satisfied with the explanation for why one may have a differing opinion than the other. But just to leave that blank, my recommendation is don't you do that. You get everybody on the same page, or you just stop and reload and get yourself another set of docs. Okay?
Well, the surgeon is the one you recommended to me.
Oh, I know this person. Yeah.
Does Dr. Caminos do catheterizations?
What he does is Dr. Caminos is a non-invasive cardiologist. Now, he's in partnership with the invasive component of his practice, and so although he doesn't do the catheterizations, he has a member on his staff that does. So Dr. Caminos is an office guy, pretty much, and he has a hospital intensivist that does all the hospital work. It's a nice way of dividing up a practice so that everybody sort of knows their role. I'm going to be here in the office. You're going to be there in the hospital. You're going to do all the caths. You'll do the angioplasties. You'll do the stents. And Dr. Caminos is pretty happy and comfortable with that. And by the way, that's pretty much the way it is across the country. Not all cardiologists are invasive. They usually partner up with people who are, and it makes a practice much more harmonious. Okay?
So Dr. Tremendous works basically through West 10 and Forbes.
I don't know all the interesting you should ask. I really need to ask him. He's coming to my office today, as a matter of fact, but he's on staff at many hospitals, and his hospital intensivist is on staff at even more than he is.
Okay, yeah, Dr. R is down at Shady Side. Okay, yeah.
Hey, good luck. It seems like your questions are so appropriate, but I hear disharmony in the air. Please get that situation resolved.
The cardiologist says my way or the highway.
You know what? That to me, this is not gunslinger. We don't need gunslinger talk right now. Okay? The patient needs to see the harmony, not disharmony. So when I start to see that kind of a personality, you know the one I'm talking about. When I see that coming up, I got to say, you know what? I'm going to have to get out of here. I know if I was talking to a doctor and I noted that was the impression I was gathering, I don't think I'd want to get cozy with that doctor.
I guess my best would be call Dr. R's office to ask for another cardiologist.
I'd get another recommendation and get everybody on the same page. It's too big of a decision to have any other way than have everybody in agreement, not to have a big disagreement. If there is a disagreement, it has to be explained to you as to why, and so that you're allowed to make the call. You can't have these two doctors fighting on the back. It's not good. Okay?
Is all your Dr. Camino's visits today booked up?
I get a feeling that I know that it's been a while. He went back to Argentina. It's been a while since he's been back here, and I'm pretty sure that he is, but we could get, you should call afterwards, probably wait about 45 minutes and have Bulu, who's his right arm nurse gal, let you know how quickly he can be seen. I'll be happy to facilitate it. She is here today, and she's the person to ask, okay?
All right, thank you. You call your office then.
You can call my office, and we'll put you in touch with Bulu today. How's that?
Okay, thank you.
Oh, yes.
Bye-bye.
Okay, a lot of questions there, folks, but you can understand why those questions came. I'm glad we could shed some light on it. What did you think? What do you think you should move to the surgery with that kind of disharmony between his doctor? I say absolutely not. Hey, anyway, you see how it goes today. Whether you have a special interest, as this previous caller did, or whether you just have a general interest, doesn't matter. Question or comment is okay with me. 412-825-6262. That's 412-825-6262. Why don't we do this? Take another short break after that lengthy discussion. And come on back. I'll be waiting to see if any other knocks on the door come. And also, too, get pencil and paper ready if you want to finalize your file on the Clot Busters. Tend to do that today. Okay. Be right back.
Your family keep healthier? Instead of learning to discuss tofu in wondrous ways, how about some real nutritional power? If your family has the typical American palate for fries, pizza, and burgers, giving your family the blessing of good nutrition is a struggle. Fruit of the Spirit is the answer for your family's nutritional needs. Fruit of the Spirit is an all-natural whole fruit puree made from fresh fruits native to the Holy Land with alkalizing minerals. Fruit of the Spirit was 5 years in the formulation, the work of a team of top nutritional experts with independent science to confirm its antioxidant power. 1 ounce a day provides the equivalent of 5 servings of fruits and minerals. Fruit of the Spirit is convenient, affordable, and delicious. Even your picky family will sing the praises of Fruit of the Spirit. Give your loved ones the blessing of good nutrition. Call 1-800-442-3793 for a special promotional offer. Fruit of the Spirit, a blessing for your good health. That's 1-800-442-3793. Call them now, 1-800-442-3793.
This is Dennis J. Courtney, MD. You become confused about how best to manage your health. It's no wonder.
Dr. Courtney, we have one call for you again, and I won't beat you for that one call.
Thank you very much.
Follow. It seems to be reasonable enough, but no matter how dutifully you follow the instructions, it just doesn't quite produce the results that you are looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, M.D. is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Good morning, everybody. Welcome back once again to AM Impact on Your Health. We're here on this Wednesday version of the show with you. We've opened it up to you to let you decide what our agenda will be today. I've had an interesting discussion with a gentleman a moment ago who had some real personal issues, as you could tell, with respect to an imposed decision to move toward a surgery for bowel replacement. Anyway, that's how technical it can get around here. It doesn't have to get that heavy. You can get much later. But 412-825-6262 will get you on in the store. In the interim, someone decided to dial us up and knock on the door. Come on now in the store. Hello and welcome aboard.
Hey.
Hello.
Hey, Doc.
Oh, Danville. It's been a while. How you been, Danville?
Oh, my neck is starting to hurt.
Why?
Why? Because I'm like, frick, my neck is killing me.
Oh, you were still having pain burns the last time I talked to you, which had to be 3 or 4 weeks ago.
Well, it's starting to now hurt daily, so I'm like, my buddy that had the fusion, he's like, well, it's going to get worse. I said, shut your mouth, man. I'm thinking, is there a different kind of chondroitin or glucosamine? Is there any difference with these products?
You know what? I think what you got to make a decision on. I know that when we last spoke, Danville, you were pretty much betting the ranch on the ability of the chondroitin and the glucosamine sulfate. You read up on it. You were taking the stuff. Now it's 3 weeks or so, 4 weeks later, and the improvements should have occurred. And if they're not occurring, you've got to be looking for another way to deal with this pain problem other than the mechanism, the intended mechanism of the glucosamines, which do work in a high percentage of people, but if they're not working in you, and they're going
no, it might be because this is junk. I mean, I don't know if this is,
okay.
It's all made out of, it says a lot about shellfish and this and crawfish. I'm trying to think what they're putting in this stuff, but.
No, you're talking about the chondroitin,
ingredients.
The chondroitin sulfate component instead of the glucosamine one, right?
I don't know. It's one combined product, so.
Okay, yeah.
It makes something out of shellfish, obviously.
Yeah, they certainly do. Essentially, the two components here with the glucosamine is to lay down a membrane in between bone, and then with the chondroitin component, put down a grid or a network. So that's a better word. A lattice work within the membrane that sort of gives it the effect of, the bubble wrap that you wrap things in?
Yep.
Okay? So it's that bubble wrap can withstand quite a bit of pressure and tension on it with a real cushiony effect, and that is what ultimately the combination of glucosamine and chondroitin sulfate do. Now look, I'm guessing, if you feel you have an inferior product, I'm going to let you make that decision, but you got to get other explanations for this other than the bone-on, the setting that the glucosamine chondroitin components would work best on would be a bone-on-bone. Like I'm thinking of knee pain, okay? Knee pain where wear and tear, a 50 or 60-year-old person who might be confronted with what's been called arthritis and possibly knee replacement, seems to be a high percentage case where the use of those two substances work well. You're talking about your neck. There's a lot more.
Rheumatoid. That's not rheumatoid or osteo. That's rheumatoid. No, that's
osteo. Osteo is wear and tear, bone on bone. Over time,
dying.
Yeah, over time, deterioration, and glucosamine and chondroitin have a tremendous help in those cases. But in your case, you need to get another look. Danville. God.
Yeah, well, what I'm gonna do is, I remember when I talked to Wallach, maybe I should be. I'm worried this stuff will start giving me, God, you know me. I don't want to end up having a tachycardia of 170 for no reason. So.
Well, I got a feeling that there's too much imprecision here.
Yeah.
You need a correct diagnosis. You've taken this pretty far, and it's not to say that there's not an herbal / non-pharmaceutical way of getting relief, but right now, Danville, I've got to be honest with you. What I also hear from you is very vague. You can't really give me a diagnosis as to why you're having this discomfort, and until you do, you can't.
Oh, because I hurt my neck playing golf, but that's another story.
Okay,
huh?
well, I mean, okay, so what is that? Is it now muscular? Is it soft tissue? Is it a joint? Is it a tendon? Is it a ligament? Is it a disc? Is it a nerve root? Hey, I'm thinking of 10 different possibilities, and you just lump that all into one. Well, with the right kind of physician guidance, you should be able to get this down to the one thing that it actually is. Right now, you got 10 possibilities, and about 6 of them, chondroitin and glucosamine can't even help. Okay, and it looks as though you got to go get some more expertise.
One thing I did read, I read that, and you and I have talked to this probably the last 3 or 4 years. They were saying that your non-GMO vitamin C is an anti-inflammatory. I didn't know that.
Well, vitamin C is a antioxidant to the extent. To the extent that it can help put out fires. I agree. So now, whether non-GMO, we're getting in a whole other matter when we're talking about non-GMO as opposed.
Oh no,
to
you said it without the bang for the buck. That GMO stuff.
That's right. But can vitamin C help put out fires? I use it every day around here. I look at a patient's C-reactive protein level, and when it's elevated, I go look for the fires that are lit, and I use vitamin C to help put them out, and you can do that too. Okay?
But I did read this one thing, and it was on dryourself.com, which is a pretty, normal site, but there was one guy, he had some inflammatory, and they couldn't do nothing for him, and he started taking about 3,000 or 4,000 C a day, non-GMO, and he got better within a week. Started, obviously has some kind of anti-inflammatory effect.
Yeah, it's an antioxidant. You have to use an antioxidant to prevent oxidation from occurring, and oxidation, I'll give you the biggest example of where that prevention will help is with an elevated LDL. LDL is one of those 4 parameters found in your lipid profile, right? And LDL by itself is completely harmless, but if it should be oxidized, it's deadly stuff. Well, guess what you should do? Take an antioxidant to prevent it from oxidizing, and in 3 weeks, I could see where you could lower the CRP and the SED rate considerably in that period of time. So, sort of 2 different things that we're talking about here, Danville. I'm really worried about you, Danville. Go get some expertise to find out which one of those 8 or 9 things you have.
Yeah, I got a buddy who's a chiropractor, but I ain't going to let him adjust my neck. I don't want to end up in the friggin'...
well, he's an expert on the joint, so to the extent that the joint is one of the 10, you need chiropractic input. But you also need physiatrist input. You could use neurology input. You could use anesthesiology input. All these inputs. You got to get more precise with the diagnosis. Go for it.
Yeah.
All right?
I was getting a little burning in my left shoulder and arm, and I was like, oh, man, pinch nerve.
Okay, go get, there's too vague right now, Danville. Go get a better diagnosis. Got me? Okay.
All righty.
All right.
Thanks.
There you go. Danville out there with a problem. Folks, anything on your mind is okay with me. You're allowed to knock on this door, 412-825-6262. Another knock has occurred. Come on the store. Hello and welcome aboard.
Hello. I want to go on topic. The idea about the beluga kinase and the comparison with that.
You want me to get back on topic? I promise to do so right now, okay?
And I was wondering also, you could, does the enzymes have any value as far as in relation? I know it's much less, but does that have any value in doing the same thing as the kinases do?
Excuse me, what kind of zymes?
Serozymes?
Okay, serapeptidases and
Yes.
and bromelain. They are proteolytic enzymes. We talked about this the other day.
Uh-huh.
And so for the reason that I'm talking about the use of Beluga and natto, it's because of its clot-busting capabilities, and you don't have much benefit from either any of the proteolytic enzymes, whether it's serapeptidases or bromelains and the like. So, no, the two best for clot busting are the natto and Beluga, and I'm going to give you those statistics right now, okay?
Okay.
Okay. You get on off the phone and get that piece of paper.
Oh, one other thing, just could you give me the spelling of that Beluga?
Beluga, B-O-L-O-U-K-E. B-O-L-O-U-K, or U-O-K-E, excuse me, B-O-L-U-O-K-E.
Okay.
All right?
Thank you.
Okay. Let me comply with the request and with my promise. We've been talking about clot busting. Look, it's a very important component, I say, of the 4 additional things that we do here that you just can't get done in any conventional medical office. We do these 4 things that will give you an advantage above all others. Quickly, that list is to put out the flames through your inflammation factors. Number 2, start to help remove that plaque through the use of something called chelation therapy. Number 3, help develop brand new blood vessels around all of your organs, not just the heart, but every other organ too. And number 4, you gotta break up clots. Why? Because clots are what cause events. Heart attacks are caused by the formation of clots somewhere that then dislodge, break loose, and become lodged abruptly in a blood vessel of the heart. And of course, when it's in the heart, that's what a heart attack is. But it could be in the brain too. And if that clot abruptly interferes with the flow of blood to the brain, that's called a stroke. These events are caused by clots. They are not caused by clogs. And so, one of the things that just has to get done is that you need to break up these clots so as to not allow them to break off, because they'd be non-existent anymore. And then there can't be any abrupt change in the blood flow to any area of the heart. So it's in keeping with that clot busting becomes so important. Now, the conventional medical community, unfortunately, does not have any very mild clot busters. They only have, they meaning the doctors and the pharmaceutical realm, they only have major league, extremely harsh, brash, effective as all get out, but you can't be taking TPA or urokinase or streptokinase. These are drugs that are made as enzymes, patented after the enzymes found in the body to do this work, and they are very effective, but they are extremely hazardous. So there are mild clot busters. We know of 2. One that has been around quite a while called nattokinase, and another that's been around a while too, but just hasn't gained the prominence, called Beluga-lumbrikinase. And I promise in a moment to get to the distinction, the numbers, the statistics for how I used to say to you, and I do say to you, that by far, in my opinion, the better of the 2 to do the job is Beluga, not natto. I'll get back to it in a second. There is a knock on the door. Come on in the store. Hello and welcome aboard. Hello.
Hello.
Yes, go right ahead.
Hello. I heard your conversation with Danville, and I felt like I should have called up right away because I have the same problem. And he is wrong in thinking a chiropractor cannot help with his back and with adjustments. He adjusted my neck, and I couldn't believe it. I felt so much better. I could move it and was hardly any sore at all. Of course, from my experience, it also depends on what chiropractor you go to. And the one I go to, he's real good. It's Dr. Michael Teep. He's in Shadyside.
Well, I'm happy to hear that you're happy.
Got good results.
Okay. I'm happy to hear that you're happy with your chiropractor. I'm in favor of chiropractic. Believe you me, they are the expert. When the joint is responsible for the problem, However, there's about 7 or 8 other areas that could also be responsible for a pain problem, and they need to have their level of expertise evaluated by those who are experts in those areas, and that's not necessarily the chiropractor. When it's a joint issue, they are the experts. And so I'm glad to hear that you got such a great response.
How do you know it's not?
Now there you go. Of course, the chiropractor should be able to make this diagnosis by the use of misalignments, taking of x-rays. I usually shed some light on it. So that's his ace in the hole. But what if it's something like, what if it's muscular? And that doesn't show up on any x-ray. That's going to have to be palpated with your hand. The only way you make muscular diagnosis is through actual physically touching and feeling into that muscle to find if it's normal or not. What if it's the disc or the nerve root? Simple x-rays alone cannot illuminate, or they cannot elucidate a diagnosis of some impingement problem. That's going to require something like an MRI or a CT. This is how the concert of doctors ultimately focus in on getting to a diagnosis to alleviate your pain. You are lucky. I'm happy for you that the chiropractor did it, and I'm sure he does it in a lot of folks, but he can't do it in all. And I'm just saying that in Danville's case, I was trying to give him some ideas of where he needs to go. He should not have it. I think I was easy to pick up on. He had a negative opinion of chiropractic, which I think is incorrect. I think chiropractic is excellent, especially if the problem is in the joint. But to know where it is an art unto itself. And to know when you can't help is also very important. So I thank you for your input. Stick with your chiropractor. Sounds like he's doing you wonderful.
Oh, yeah.
Keep it up. Keep it up. Okay.
Okay, bye.
Thank you very much for the call. Yeah. Hey, all right. Think the world of these guys. All right, here we go. We're back to talking about the Beluga with some numbers now, which helped me make a decision a while back. Because I've been looking at nattokinase and Beluga for a while. And I'm trying to make a decision, and as any doctor should, about, okay, what are you going to recommend as a doctor to your patients? And I've come down on the side of the Beluga for a long time now. Now, why did I do that? Well, some people that I deeply respect, most particularly Sir Arnold Takimoto, I think, had quite an influence on me. In fact, it was while going through a large file that I have on the subject, which I dusted off a couple of weeks ago, that I came across his entire talk. He must have a 45-minute to an hour seminar on Beluga and natto. And I was going through that. And here came the information that I probably saw that many years ago that helped confirm it in my mind. I'm now passing it on to you. Let's see what some of this scientific information is. The first thing I want to mention is, because I got a chart in front of me. You don't have it, but I do. And it is a chart that compares 5 different things. Beluga, natto, another column called Beluga imitators, serrapeptidases, which is a proteolytic enzyme, and bromelain. Now, knowing that this chart, which was the best I've seen in a while, helps me to answer some of the questions that were presented to me today, I'm thankful that Dr. Takimoto gave this to me, Sir Arnold Takimoto. But let me share with you a couple things that glare at me off of these pages, and I think solidified my opinion so long ago, and if it helps you, that's wonderful. The first thing that hits me from this chart is, number one, a category called Historical Uses of History of Large Clinical Use with a Safe Record. Now, I want to tell you, when I went into the literature, and thank you, Sir Arnold Takimoto, what I found is that Beluga, not nattokinase, but Beluga, has had many trials, phase 1, phase 2, phase 3 trials, scientifically controlled studies, especially in the Orient, and for that reason has been safely used in hospitals in China since 1995. Nattokinase has not been used in any way, shape, or form because there were no clinical trials done with natto. That doesn't mean it couldn't potentially have great benefit, but when you start adding up this factor with the others that I'll mention to you, I think an undeniable picture emerges. That first off, there's plenty of studies done on Beluga, so much so that the safety profile was met and is used medically in the Orient, especially in China. Next point. There has to be a measurement, right? If you're going to be talking about how well something works, you want objectivity, I want objectivity, and so one of the objective parameters that I came to trust is something called a plasmin unit. Now, I don't want to get too bogged down and scientific, but let's just say that a plasmin unit is a measure of how effective either of these two products are. And in terms of Beluga, it has a CU, which is you'd think it'd be PU, but it's CU, a plasmin unit of 100 CUs per gram of wet weight. Nattokinase has 40 CUs per gram of wet weight. So there's the first difference right off the bat, that whenever they studied it, they found that plasmin units, which is a measure of clot-busting capabilities, Beluga was head over heels, and much better postured to be able to have the capability to clot bust. The next category, I believe a very important category, I think this one tells the tale better than any of them, and this category is the enzyme in the product is standardized against urokinase and TPA. Here again, I don't want to get too scientific. I don't want to confuse you, but there are normal clot busters found in the body in the fibrinolytic system. One called TPA, that stands for Tissue Plasminogen Activator. Don't worry about that. Just know that TPA is a measurement of the ability to clot bust, and urokinase is a natural product that also breaks up clots. It's made by the human body. So with those two things in mind, how do these two clot busters stack up? Well, in the case of Beluga, it contains no less than 120,000 units of TPA activity and no less than 100 units of urokinase activity. Now remember the numbers, 120,000 and no less than 100 units of urokinase activity. When compared to natto, how does it shake out? Well, in the case of natto, it has 12,000 units of TPA activity. Look at 120,000 units of it. So it's 1/10 as powerful as a clot buster. And natto contains 1.6 units of urokinase activity. Look, folks, it's not even close in terms of measurable clot-busting activity using scientific and objective means by which to quantify how potent each of these potentially are. And as you can see, as I'm seeing, and I hope you're seeing right along with me, this Beluga is head over heels able to provide much more clot-busting activity than nattokinase. I think that is a key component. Now, the last study, and I've had to whittle through. There are plenty more studies that I could mention. I decided not to. But the last study is a category called viscosity reduction. The thickness of the blood is its viscosity. The better you're able to do clot busting, the greater impact you have on the viscosity, and you're able to lower the viscosity, making this stuff more fluid as opposed to more glue-like. In the case of nattokinase, there was a study done on the same individuals who each and every time they took, well, one case, 4 caps at baseline. Then they did the same study with nattokinase when the same person was taking 8 caps per day, then another one 20 caps a day, and finally I'm going to end up with the final comparison with a patient who took 20 caps capsules at baseline compared to a person who took 2 capsules of Beluca. Now, by the way, this is the same person, not different people. So that whatever his physiology is or was, it's working the same on both substances, not 2 different people that could have a potentially different way of reacting completely. And the final reduction of viscosity in the person taking up to 20 capsules of nattokinase was it reduced the viscosity of the blood by 15%. However, on 2 capsules of Beluca, the viscosity was reduced 38.9%. Folks, I hope I didn't confuse you, but I hope I gave you parameters of objectivity that back up what I've always considered to be the better use of choicing when it comes to clot busting, which is to use Beluca and not natto. And it's for that reason, by the way, we only stock the Beluca in my office. We don't even worry about the natto. It's attainable, and it does work. It's so mild that when we need clot busting to take place, we need the more potent material. Hey, I have another knock on the door. Come on in the store. Hello. Welcome aboard.
Yes, Dr. Courtney.
Yes.
Could you explain what congestive heart failure is and what's the treatment for it? And I'll hang up and listen.
Okay.
Thank you.
Yes. Congestive heart failure. You know, these ventricles, 4 chambers in the heart, the lower chambers are the ventricles, and they push blood out of the heart. The right ventricle pushes it to the lung. The left ventricle pushes it out to the rest of the body. When these ventricles do not have the squeezing capability to push effectively, blood backs up. If it backs up, we call the condition that occurs from the backup of blood a congestive heart failure component.
If you like it.
Okay. When it's the right ventricle that can't handle the job and push blood to the lungs, then blood backs up into the venous system and is going to be hallmarked by having edema of the legs and feet and toes, and that'll be right-sided heart failure. When it's the left ventricle that doesn't squeeze effectively enough and the blood backs up, the congestion occurs in the lungs, and as such, you get pulmonary symptoms, coughing, spitting up of pink frothy fluid, and difficulty in breathing and shortness of breath. So you get respiratory symptoms whenever it's left-sided failure. You get peripheral edema symptoms when it's right-sided failure. Left-sided failure to the lungs, right-sided failure to the periphery. How you end up treating it is that you have to have, there are agents, by the way, the pharmaceutical way of treating it, using something called digitalis, which makes an inotropic agent that causes very good squeezing to take place. Now, there are some non-drug ways of doing it, too. We'll talk about that. I hope that answers your question. We got real cardiovascular on you today, folks. I hope you can put the issue, at least, of Beluca and natto to rest. I know I am. Look, I'll see you on Friday. We'll open them up again for you on Friday. Until then, this is Dr. Dennis Courtney saying so long for and impact on your health.
Sponsored by Courtney, Director of the Courtney Medical Group, located at 3075 Washington Road in McMurray, Pennsylvania. For more information or to make an appointment, call 724-942-3002. That's 724-942-3002 for Dennis J. Courtney, MD.